Introduction. Welcome to the first module of this comprehensive lecture series on public health and nutrition. In this module, we will explore the foundational aspects of nutritional science, its role in public health, and how nutrition is assessed and monitored at the population level. Understanding the complex relationship between diet and health outcomes is essential for developing effective public health strategies, especially in an era marked by a double burden of malnutrition, where undernutrition and overnutrition coexist. This module is structured around key thematic areas, beginning with an introduction to macronutrients and micronutrients, moving through the consequences of dietary deficiencies and toxicities, and then examining the tools used to assess nutritional status across communities. We will also explore the factors that influence dietary choices, as well as the health effects of different diets and nutrients. Let's begin with the basic principles of nutritional science. Introduction to nutritional science, macronutrients and micronutrients. Nutritional science is the study of how food and its components affect the health and functioning of the human body. It encompasses the biochemical and physiological processes that involve nutrients and other food substances. Nutrients are typically classified into two broad categories: macronutrients and micronutrients. Macronutrients are nutrients that are required in large amounts by the body. These include carbohydrates, which serve as the primary source of energy; proteins, which are essential for tissue repair, immune function, and enzymatic processes; fats, which provide a dense source of energy, are vital for the absorption of fat-soluble vitamins, and contribute to cellular structure. Water is also considered a macronutrient due to the large quantity needed for bodily functions, though it does not provide energy. Micronutrients, on the other hand, are required in smaller amounts but are equally essential for proper body functioning. These include vitamins, such as vitamin A, C, D, E, K, and the B-complex vitamins; minerals, such as iron, calcium, magnesium, zinc, and iodine. While macronutrients provide energy and structural components, micronutrients primarily support metabolic processes and disease prevention. Dietary deficiency and toxicity. Maintaining a balanced intake of nutrients is crucial, as both deficiencies and excesses can lead to health complications. Dietary deficiencies occur when the intake of essential nutrients falls below the body's requirements. Some common deficiency-related conditions include iron deficiency anemia, leading to fatigue and impaired cognitive function; vitamin A deficiency, which can cause night blindness and increase susceptibility to infections; iodine deficiency, a leading cause of preventable intellectual disability worldwide; protein energy malnutrition, seen in severe forms like kwashiorkor and marasmus, especially in children. Toxicity, on the other hand, arises when nutrients are consumed in excessive amounts. While this is more common with fat-soluble vitamins and minerals due to their storage in the body, it can occur with water-soluble vitamins in extreme cases. For example, vitamin A toxicity can cause liver damage, headaches, and blurred vision. Iron overload may result in organ damage and can be fatal if untreated. A balanced diet is essential to avoid both under- and overnutrition. Nutritional surveillance and assessment at the population level. Public health nutrition involves the monitoring of nutritional status across different population groups. Nutritional surveillance is the systematic collection, analysis, and interpretation of nutritional data, which is essential for planning and evaluating public health interventions. Several tools and methods are used for nutritional assessment, including anthropometric measurements, such as weight for age, height for age, and body mass index, which help assess growth patterns and detect malnutrition. Dietary assessments, including food frequency questionnaires, 24-hour dietary recalls, and food diaries, which estimate nutrient intake. Biochemical tests, which measure nutrient levels in blood or urine. Clinical assessments, where physical signs and symptoms are used to detect nutritional disorders. Data collected through these methods guide public health policies, food fortification programs, and emergency responses during food crises. Markers of nutritional status in populations. Markers or indicators of nutritional status provide insights into the health and well-being of populations. These markers may be biological, clinical, or behavioral in nature. Common nutritional markers include anemia prevalence, often used as a proxy for iron deficiency. Stunting and wasting rates, which reflect chronic and acute undernutrition in children. Vitamin A and iodine status, assessed through blood and urine biomarkers. Obesity prevalence, an indicator of overnutrition and a risk factor for non-communicable diseases. These markers help identify at-risk groups, track progress toward nutrition-related goals, and evaluate the effectiveness of health interventions. Dietary recommendations and guidelines at the population level. Governments and health organizations issue dietary guidelines to help populations maintain healthy eating patterns. These recommendations are typically based on scientific evidence and aim to promote health and prevent diet-related diseases. Dietary guidelines include recommendations such as consuming a variety of foods from all food groups, limiting intake of saturated fats, added sugars, and sodium, increasing consumption of fruits, vegetables, whole grains, and lean proteins, maintaining appropriate portion sizes and caloric intake. Some countries develop food guides, such as the Food Pyramid or MyPlate, to visually represent these recommendations. Population-wide adherence to such guidelines is a cornerstone of preventive health care. Determinants of dietary choice in populations. Dietary choices are influenced by a complex interplay of individual, cultural, economic, and environmental factors. Some major determinants include socioeconomic status, affecting access to nutritious foods. Cultural and religious beliefs, shaping food preferences and taboos. Education and nutrition literacy, impacting understanding of healthy diets. Food availability and accessibility, especially in urban versus rural areas. Marketing and advertising, which can influence children's and adults' food choices. Understanding these determinants is crucial for designing effective nutrition programs that are culturally appropriate and sustainable. Health effects of nutrients, foods, and diets. The link between diet and health is well established. Nutrients and foods can either protect against or contribute to the development of various diseases. Some health effects include high-fiber diets, associated with lower risks of cardiovascular disease, type 2 diabetes, and colon cancer. Saturated fats and trans fats, linked to increased risk of heart disease. High sodium intake, a major contributor to hypertension. Antioxidant-rich diets, which help combat oxidative stress and inflammation. Dietary patterns such as the Mediterranean diet and plant-based diets are often associated with better health outcomes compared to Western dietary patterns rich in processed foods. Major foodborne diseases. Food safety is a critical component of public health nutrition. Contaminated food can lead to outbreaks of foodborne illnesses, which are often preventable. Common foodborne diseases include salmonellosis, caused by Salmonella bacteria, typically found in undercooked poultry and eggs. Listeriosis, linked to unpasteurized dairy products and deli meats. Hepatitis A viral infection transmitted through contaminated food or water. E. coli infection, which can cause severe diarrhea and kidney failure, especially in children. Proper food handling, hygiene, and regulatory oversight are essential to prevent these diseases and protect public health. Diseases of overnutrition and unhealthy dietary choices in developed and developing countries. Overnutrition occurs when nutrient intake exceeds the body's needs, leading to weight gain and associated health problems. This is increasingly common in both developed and developing countries. Key diseases associated with overnutrition include obesity, a major risk factor for diabetes, heart disease, and certain cancers. Type 2 diabetes, strongly linked to excessive sugar and refined carbohydrate intake. Cardiovascular diseases, often driven by diets high in saturated fats and sodium. Non-alcoholic fatty liver disease, associated with high-calorie diets and obesity. Globalization, urbanization, and sedentary lifestyles have contributed to the growing epidemic of overnutrition, even in regions where undernutrition remains a challenge. Diseases of undernutrition in developed and developing countries. Undernutrition remains a significant public health concern, particularly among vulnerable populations such as children, pregnant women, and the elderly. Forms of undernutrition include stunting, or impaired growth and development due to chronic malnutrition. Wasting, or acute weight loss often caused by illness or food shortage. Underweight, indicating insufficient body mass relative to age or height. In developing countries, undernutrition is often due to poverty, food insecurity, and infectious diseases. In developed countries, it may be linked to eating disorders, chronic illness, or inadequate access to nutritious foods, particularly among low-income groups. Conclusion of Module 1. In this first module, we have laid the groundwork for understanding the essential concepts of nutrition within a public health framework. We explored the science of nutrients, the dangers of dietary imbalances, and how nutrition is assessed at the population level. We also examined how various factors shape dietary choices and the health impacts of poor nutrition. In Module 2, we will delve deeper into maternal nutrition, the impact of malnutrition during pregnancy, and strategies for designing and evaluating interventions that improve dietary choices and nutritional outcomes.